Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Cardiovascular drugs. As a knowledgeable nurse, you know that the action of nitrates is Option A. Smooth muscle contraction. Option B. Vasoconstriction. Option C. Smooth muscle relaxation. Option D. Increase preload. Right answer is Option C. Smooth muscle relaxation. Nitrates cause smooth muscle relaxation, vasodilation, reduction of preload, and improved blood flow to the myocardium. Other choices have opposite effect of nitrates. A 50-year-old client is prescribed to take nitrate each day for his condition. As a competent nurse, you know the result of nitrate administration is Option A. Decreased myocardial oxygen demand. Option B. Increased myocardial oxygen demand. Option C. Increased left ventricular and diastolic volume. Option D. Increased atrial pressure. Right answer is Option A. Decreased myocardial oxygen demand. Nitrate administration will result in reduced preload and a decrease in myocardial oxygen demand and left ventricular and diastolic volume. A student nurse is asked to give an example of a long-acting nitrate. He is correct by saying Option A. Nitroglycerin sublingual. Option B. Nitroglycerin 4. Option C. Isosorbide PO. Option D. Nitroglycerin transmucosal. Right answer is Option C. Isosorbide PO. Isosorbide is one of the most frequently administered long-acting nitrates. PO nitrates are longer-acting than 4 or SL agents. When nitrates are administered early to the acute ME client, the effect is Option A. Hypotension. Option B. Bradycardia. Option C. Reduced mortality. Option D. Reduced morbidity. Right answer is Option C. Reduced mortality. Research has shown that when nitrates are administered early to the acute ME client, the effect is reduced mortality, infarct size, infarct extension, and related complications. Hypotension will result from nitrate administration, but it is not the reason for prescribing the drug. Tachycardia rather than bradycardia is more likely to occur with nitrate administration. The morbidity is already present because the client has the pain. When teaching about nitrate administration, the nurse should instruct the client to Option A. Change position slowly. Option B. Take pulse daily. Option C. Reduce salt intake. Option D. Chew the sustained release tablets. Right answer is Option A. Change position slowly. Clients taking nitrates should change position slowly to avoid orthostatic hypotension. It is not necessary to take the pulse before taking this drug. It is also not necessary to change the diet while taking this drug. It is contraindicated to chew sustained-release tablets. ACEs participate in the renin-angiotensin-aldosterone system to have which of the following physiologic effects? Option A. Inhibit conversion of angiotensin II to angiotensin I. Option B. Vasoconstriction and sodium depletion. Option C. Promote sodium and water retention. Option D. Stimulate vasodilation and inhibit sodium depletion. Right answer is Option C. Promote sodium and water retention. Angiotensin is a potent vasoconstrictor that stimulates the release of aldosterone. Aldosterone release promotes sodium and water retention. The conversion of angiotensin I to II is not inhibited. Aldosterone promotes sodium retention, not depletion. Vasoconstriction, not vasodilation results. Nurse Margie just administered an ACE inhibitor to her client. Before ambulating the client for the first time after administration, the nurse should monitor for Option A. Hypokalemia. Option B. irregular heartbeat. Option C, edema. Option D, hypotension. Right answer is option D, hypotension. ACE inhibitors prevent vasoconstriction and lower blood pressure, placing the client at greater risk for postural, orthostatic, hypotension. ACE inhibitors reduce potassium excretion, placing the client at risk for hyperkalemia. ACE inhibitors do not affect heart rate. ACE inhibitor promotes sodium excretion, thereby decreasing edema. Mira is managing her hypertension with an ACE inhibitor. Which of the following statements stated by her indicates a need for further instruction? Option A, I should not take my pills with food. Option B, I need to increase my intake of orange juice, bananas, and green vegetables. Option C, I will avoid coffee, tea, and colas. Option D, I will use salt substitutes that are not high in potassium. Right answer is option B, I need to increase my intake of orange juice, bananas, and green vegetables. The client needs to understand the risk of hyperkalemia and foods to eat in moderation. Taking medications with food will decrease therapeutic effects of ACE inhibitors. Excessive amounts of caffeine should be avoided. Avoidance of salt substitutes that are high in potassium decrease the risk of hyperkalemia. Pepito is a hypertensive client who has been placed on captopril, Capoten. He states, Dr. Del Mundo keeps changing my pills and none are working. I feel like a guinea pig. Which of the following responses by the nurse would be most appropriate? Option A, it often takes a while before the right medication is found. Option B, the doctor is just trying to help you control your blood pressure. Option C, the action of this drug is to work on both the arteries and to remove excess fluids. Option D, this drug is used when other drugs have failed. Right answer is option D, this drug is used when other drugs have failed. This response provides accurate information about the medication. Choice A placates the client and provides no information about the new medication. Choice B is defensive. Although choice C is true, there is no information provided to motivate the client. The action of an ACE inhibitor interrupts the renin-angiotensin-aldosterone mechanism, thereby producing which of the following? Option A, reduced renal blood flow. Option B, reduced sodium and water excretion. Option C, increased peripheral vascular resistance. Option D, increased sodium excretion and potassium reabsorption. Right answer is option D, increased sodium excretion and potassium reabsorption. The inhibition of aldosterone increases sodium excretion and reduces potassium excretion. ACE inhibitors increases renal blood flow. Excretion of sodium and water is enhanced by ACE inhibitors. Peripheral vascular resistance is decreased by vasodilation effect of ACE inhibitors. Thanks for watching. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.